This is Daniel Sledge on November the 10th, 2025. We are in Washington, D.C. at the United Nations Foundation, conducting an interview for the Global Oral History of PEPFAR project. To begin, could you begin by introducing yourself?
Hi, I'm John Lange, retired ambassador. Who I had a career in the Foreign Service, and I was one of the two Deputy Global AIDS Coordinators at the inception of PEPFAR.
Please, if you could tell us a little bit about yourself, your parents, where you grew up, and your education.
I was born in Milwaukee, Wisconsin, and grew up in a distant suburb called Muskego, Wisconsin. Graduated from the University of Wisconsin-Madison with a political science degree and then a law degree. And after my studies at the university, I never really practiced law. I ended up moving to New York City to work for the United Nations Association of the USA, a nonprofit supporting U.S. participation in the UN, for 5 years until 1981 when I joined the State Department's Foreign Service.
What was your knowledge of Africa before you joined the service?
I was very interested in developing countries, and I had taken some courses as an undergraduate at the University of Wisconsin on African politics and African political developments and colonization, a big issue back then. And then when I got to New York to work at the UN Association, we were very involved in a variety of UN issues, almost all of which affected Africa. But I'd never been to Africa before I joined the State Department.
So you joined in 1981, which is sort of a major year for HIV/AIDS. What was your sense of the global HIV/AIDS crisis in those early years of your Foreign Service career?
In the Foreign Service, I was a generalist. I didn't have a specialty per se. And as a generalist, I did various kinds of jobs, but none of them in my early career at the State Department were involved with public health issues. Mm-hmm. And I knew about the HIV/AIDS crisis, and I think it was Rock Hudson who famously came to Paris when I was stationed at the U.S. Embassy in Paris, and ended up dying of HIV. AIDS, and there, so it was coming across my awareness, but I wasn't really focused on it at all.
Mm. What did you see as the scale of the pandemic grew? I think you were in Togo early on, is that right?
My first tour in Africa was in Togo, in Lomé, Togo, in 1989 to 1991. Mm. My job was in management of the embassy, not on the USAID or public health side. Mm-hmm. And after that, I went to Geneva to work at the U.S. mission to the UN on issues related to refugees and migration and humanitarian assistance. And we were concerned about health issues for the refugees in a general sense, including HIV/AIDS, but that wasn't the main focus because it was a time of great turmoil with the breakup of Yugoslavia and then later on the genocide in Rwanda. And so there were so many immediate concerns of food and shelter and clothing, as well as health issues for refugees, that it wasn't really a big issue for me at that point. And then after that tour of duty, I went to Washington.
Okay. So you said elsewhere that you really hadn't done much public health work before your service in Botswana. Had you thought at all about the significance of public health and HIV/AIDS to U.S.-African relations or to national security during the early years of your foreign service?
Not really, because to be frank, and I think I could speak for a lot of State Department Foreign Service officers in that period, we thought of public health issues as something that USAID worked on. And in some cases there was a presence of the Centers for Disease Control and Prevention, but often it was, the lead was the U.S. Agency for International Development at post, whatever embassy you were assigned to. And you kind of left it to them. agricultural issues, education, the various issues related to development that USAID worked on. They were the experts on it. So I wasn't really involved in that and focused on it very much. Even, I would say, in my next tour in Africa after Washington, which was in Tanzania.
Fantastic. Let's talk a little bit about your time in Tanzania. How did you come to take on that role, and what were your responsibilities?
Yeah, I was working as the Deputy Director for East African Affairs in the State Department's African Affairs Bureau. And there was a sudden opening for the number 2, the Deputy Chief of Mission, at the U.S. Embassy in Dar es Salaam, Tanzania. And I was clearly knowledgeable. I was by then a Foreign Service Officer at the 1 level, which is right below the Senior Foreign Service. And I was available, and my family and I uprooted ourselves within a couple of months and moved to Dar es Salaam, and we arrived there in December of 1997. And I was immediately, after the first couple of days when the previous acting ambassador left, I was in charge because there was no U.S. ambassador. There was a 10-month gap, more or less, between U.S. ambassadors. And I therefore became what we call chargé d'affaires as the acting ambassador of the embassy. And I was in that position for about 8.5, 9 months, or even more, before the next U.S. ambassador came.
What was the situation on the ground when you arrived in Tanzania in terms of the HIV crisis, funding, and in terms of the infrastructure to take on HIV/AIDS?
Yeah, I ended up, I remember writing in our mission performance plan, which we had to submit to the State Department, and I wrote there in my Chief of Mission statement in June of 1998 how HIV/AIDS was widespread. And the government was trying to deal with it, but didn't really have all that many resources for it. USAID had a health officer who was focused on this, and we were trying to provide assistance. Tanzania had undergone some major changes in its health program because it was all provided by the government, and that wasn't working. So they developed some structural reforms in their health system, such as cost sharing and emphasis on public-private partnerships and other administrative efficiencies that tried to restructure the health program, although they weren't totally successful on that. But on the whole, it was clearly HIV/AIDS was present. And in fact, the cook that we had hired at our house, who we inherited from the previous deputy chief of mission, was HIV positive. And we knew that. And he's a wonderful man, a wonderful cook. And sadly, a few years after we left, he died of AIDS. But it was clearly present. And I was clearly much more aware of the concern of the spread of HIV than I had been when I first got to Togo 10 years earlier. It was clearly spreading, and also Tanzania had its connections to Southern Africa through the Southern African Development Community, and really the problem was far worse in Southern Africa.
And so you showed up in late 1997. Obviously, in 1998, there were the truck bombs in Dar es Salaam and Nairobi. How, if at all, did that experience shape how you thought about security and public health?
Yeah, to briefly summarize it, Osama bin Laden and Al-Qaeda bombed 2 U.S. embassies simultaneously on August 7th, 1998. That was the U.S. Embassy in Nairobi and the U.S. Embassy in Dar es Salaam. And I was in my office chairing a meeting when the bomb went off. We had no advance warning whatsoever. 11 people died and over 85 were injured in Dar es Salaam. And in Nairobi, it was over 200 people died and thousands were injured. These were just tragic situations that still resonate today in terms of the U.S. Foreign Service. To have two U.S. embassies bombed simultaneously is just shocking. One of the things I learned from that was the threat of terrorism in the United States. Obviously, that was kind of the biggest learning that we took from it. And a lot of us were very angry when a little over 3 years later, 9/11 occurred in the United States on September 11th, 2001, because we wished that we had gotten Osama bin Laden after the bombings of the embassies in 1998. But the one thing that I have to say that I ended up having to display when I was running this recovery operation and the rescue operation immediately after the bombing was the importance of leadership. And I learned a lot of personal lessons on this. I delegated more than I ever did before because we had to respond quickly, and I had to make what seemed like a decision a minute as people who worked at the embassy were coming up to me asking me about what should be the next steps in our recovery. And that leadership, I think, is one of the most important things that is needed in so many walks of life, but particularly I found it later when I went to Botswana, the need for it in public health. And I think leadership is really a key element for successful public health programs.
So after Tanzania, you moved on to Botswana. You were the ambassador in Botswana. Can you tell us a little bit about that transition? Why did that move happen? What did that look like for you?
Yes, based on the way we recovered from the bombing in Dar es Salaam in 1998, when I was leading the embassy, and then afterward when the ambassador came and I moved to be the number 2 again, President Clinton decided to pull me out of Botswana early. I was supposed to be there 3 years. Instead, I was only there for a year and a half. Sorry, pulled me out of Tanzania early. And I was there then until June or July of 1999, when I ended up being transferred back to Washington so I could prepare for my confirmation hearing as U.S. Ambassador to Botswana, because I'd been nominated by the president. And that is a long process to go through a presidential nomination. I once counted the number of steps, and it's like 15 or 20 steps in there in terms of papers that have to be filed, and everything that has to be done even before you get to the Senate Foreign Relations Committee and the confirmation hearing, and finally confirmation by the Senate. But I went through that process, and I'm grateful that I was nominated by President Clinton. And then I was finally confirmed in November of 1999.
When you arrived in Botswana, what was the situation on the ground like in terms of HIV, in terms of the humanitarian crisis related to it, in terms of funding, and in terms of just infrastructure?
Yeah, first of all, when you're an ambassador, you when you're nominated to a position, you prepare for it. So I had done a lot of research and met with a lot of people in Washington before I was confirmed by the Senate and then sworn in as ambassador in December of '99, and then flew to Gaborone. And so I was very well aware of the situation even before I arrived there. But one of the things you do as an ambassador, you look at the totality of U.S. government interests in the country. And it's your job to really be on top of all of that and to know what U.S. government policy is, et cetera. And so I looked at this wonderful country of Botswana, which then had something like 1.7, 1.8 million people. And having lived in West Africa, in Togo, and in East Africa, Tanzania, and then moving to Southern Africa, in Botswana, it was so clear that what many African countries aspired to, Botswana already had. It was a long-standing democracy since its independence in 1966. Although there had only been one party that had come to power, but they still held democratic elections. They had very good governance. Some really top-notch people were people who had worked at the International Monetary Fund or the World Bank and elsewhere, who were in high-level positions running the country. They had low levels of corruption. One of the things I really liked when you arrived at the border posts, if you were driving and you came to come back into Botswana, they had this big sign that Botswana has zero tolerance for corruption, capital Z-E-R-O. And that doesn't mean they had no corruption, but it was nowhere near as pervasive as you can find in some countries. And in some ways that's surprising, because some countries have what they call the resource curse, where they have oil or some other natural resource that ends up breeding corruption. Botswana had diamonds, but they ran it with they ran the Debswana Mining Company that they half owned with De Beers, and therefore it was run as a private company, but half of the profits and half of the benefits then went to the government of Botswana. So their economy was doing very well, although it was very focused on just a few sectors: the diamond sector, the tourism and wildlife, which is just wonderful there, one of the great places in the world for safaris, and then to some extent the cattle industry. And then it had a relatively free press, and you could see a lot of back and forth in the newspapers. So it had so many things going for it. The military, the U.S. military, very much like the Botswana military. It was small, it was under civilian control, they were very competent. There were so many reasons to think that this is what an African country should aspire to. And then, to answer your question about the HIV/AIDS situation, 38.5% of all adults aged 15 to 49 were estimated to be HIV positive. And that number turned out to be high based on the methodology they were using of testing women in prenatal clinics. It was probably closer to 33%. But basically, 1 out of every 3 adults you met was HIV positive. And this was a time when I got there in December 1999, when antiretroviral therapy, to allow you to live indefinitely with HIV, cost $10,000 per person per year. The average income in Botswana per capita was $3,000. So there was no way that anyone could afford this except the richest people and the top people in government, et cetera, could afford that antiretroviral therapy. This was just a disaster. And I made it my signature issue. Ambassadors have leeway as to what they want to emphasize within their broad support for U.S. national interests. But I made this my signature issue because it was just killing the country.
Could you tell us a little bit about the leadership, in Botswana itself? So President Festus Mogae, people like Minister Joy Pumafi. Could you tell us a little bit about what they were like, how that government operated, and what your interactions with them were like?
Yes, I ended up meeting President Mogae in my first 10 days or so at post, because I had to present my credentials, and we arranged for it to take place before Christmas of 1999. That's when I first met him. Very early on met Joy Pumafi, who was the Minister of Health at the time, and since has gone on to leadership roles at the World Health Organization and the World Bank and the African Leaders Malaria Alliance in global health issues. And they were very attuned to this concern. Mogae, when I was there, gave very candid speeches to the people of Botswana. He said that the country faced, quote, a blank extinction based on the spread of AIDS. And he was really forthcoming on this in such a positive way, very supportive of all kinds of efforts to prevent the spread of HIV and to improve programs for care and treatment. And Joy Pomapi was totally on board with him, and she would give passionate speeches to the people of Botswana in all kinds of forums. And I dealt with them very, very frequently, in part facilitated by Dr. Tom Kenyon, who was the lead for CDC at the U.S. Embassy when I arrived and was there during my entire 3-year tour.
Could you tell us a little bit about Dr. Kenyon?
One of my heroes in the fight against AIDS. He was in Botswana for several years before I arrived there, and we left about the same time in August of 2002. And he was the head of what was called the Batusa Project. It was a Botswana-USA collaboration housed in the Ministry of Health, which is, again, is that close connection working with the Minister of Health, Joy Pumapi. But he was a real innovator. Now, when Batusa began, it was focused on tuberculosis. And that was back in, I think, 1996, if I recall correctly. Batusa started on TB, but then became focused on, in addition to TB, HIV and AIDS, because the connection was tuberculosis was an opportunistic infection for those who were suffering from AIDS. Many people who suffer from AIDS die of AIDS-related illnesses, such as tuberculosis. And Tom was just such an expert on this and worked so hard and had such strong connections with the ministry. We can talk a bit about their many projects, but they were very impressive, and he was really a leader driving this whole U.S. government effort.
Yeah, there was already a fair amount going on, as I understand it, when you showed up in Botswana. For instance, the Botswana-Harvard Health Partnership had started back in 1996. How did you get a handle on all the different initiatives that were going on the ground?
Yeah, well, none of them had to coordinate with us unless it was something that we were funding. And sometimes we didn't even know that the U.S. government was funding something because it would be a National Institute of Health grant to a university in the United States, and the university would show up and they never told us, oh, by the way, you, the U.S. government, are funding us. And so it took me a while sometimes to understand all of those connections. Tom Kenyon facilitated many of the connections, of course, because he knew all the people who were HIV/AIDS leaders in the country. They called on me. They knew I had a reputation that I quickly developed as someone who really cared about HIV/AIDS, was very engaged on the issue. I would say almost all of them, maybe every non-governmental organization or university connected to the United States at one point came to my office, requested an appointment, came to my office, and we talked about their program. And I tried to be supportive of all of them because my basic thought on this was, let every flower bloom. We need as many programs as possible. So I didn't feel any sense of competition among these programs. There was just so much to be done, and it was really impossible for all the needs to be met.
Somewhat related, the Embassy's Office of Defense Cooperation constructed voluntary counseling and testing centers with DoD support. How did that project start, and what was the scope of that project? Also, why was this of interest to the DoD?
Well, the Department of Defense at that time had what was called a humanitarian assistance program. And initially it was done for Botswana's purposes through the European Command. Later on they created the Africa Command. But the Office of Defense Cooperation was using money provided by the Humanitarian Assistance Program to build voluntary counseling and testing centers that were then staffed and equipped by CDC, Dr. Tom Kenyon's office, in the Batusa project. So you had this wonderful collaboration within the U.S. government between the Office of Defense Cooperation and CDC to put together these voluntary counseling and testing centers. Now, the gateway to HIV prevention is to know your status, to know if you are HIV positive. And when I got to Botswana, the only way you could find out if you were HIV positive was to go to your doctor, have a blood test taken, and have the doctor send the sample to neighboring South Africa. It was just a process that was very cumbersome, and it shows how primitive the infrastructure was in Botswana, in a sense, when I arrived in 1999. Well, in these voluntary counseling and testing centers, they were able to get people to come in to be tested anonymously, and then find out the results within the same day or within a few days. Procedure got to be faster as time went on, and we ended up having these. I think they were initiated, I believe, by Tom Kenyon, by the Batusa project, but then ODC was happy to provide this. And then in the end, I think when I was there in my 3 years, nearly 3 years there, we had 12 openings of these voluntary counseling and testing centers, and the goal was to have a total of about 15 of them. Now you ask, why did the Department of Defense care about this? Well, ODC, the Office of Defense Cooperation, was doing even more than that. They were planning, I know, to build an orphan care facility when I was there, and they ended up providing training programs to the Botswana Defense Forces. The interest of the Department of Defense was that you didn't want to have a country that was democratic, strongly supported by the U.S. government, had a good military, a military that on occasion participated in African peacekeeping operations, which we were supporting. And you didn't want to have them weakened and become unstable because of the high rates of AIDS spreading among the populace and including among the military. So the Department of Defense was interested in this and found it in its own interest, as well as in the broader U.S. government interest, to help with the voluntary counseling testing centers and the training of the Botswana Defense Forces.
And I believe you also launched an initiative with USAID aimed at addressing stigma around HIV/AIDS. How did this start, and what was your interest in that?
Yeah, I have to say that it's one of the most frustrating things to me from my time there, because stigma was just pervasive. And you had people just didn't want to know their status because they feared that they could be HIV positive. So USAID provided us with some funding that we could do in terms of what we called the U.S. Ambassadors Initiative on HIV and AIDS. We had a program to educate the media on reporting on HIV, to make sure there was accurate reporting on the nature of the illness, to work with youth groups, and we gave money to a student group at the University of Botswana, the largest university there, and to community-based organizations. And so this was using USAID funds to help out and promote. These were small projects, but we thought they made a difference, educating students in college and others about the need to take precautions and not to take risks.
Mm-hmm. So this is during an era in which there are conversations about ABC, abstinence, be faithful, and use condoms. How did these conversations, both sort of local and globally, impact your work in Botswana?
It's interesting because when I recently reviewed the documents from the period when I was the ambassador to Botswana, ABC was not an issue. We knew that it was something that President Museveni was promoting in Uganda, but that wasn't the approach we were taking. Because of the high cost of antiretroviral therapy, and this was in the pre-PEPFAR era, before the U.S. government created the President's Emergency Plan for AIDS Relief, we ended up focusing on prevention and trying to minimize stigma, trying to get people to take precautions, to not put themselves at risk. And I must say, I gave speeches emphasizing this and the need to know your status. And as I said, go to voluntary counseling and testing centers to be tested anonymously. But I never used the word condom. And I know there was some controversies in the United States about whether the U.S. government should be promoting condom usage. But that was not the basis for my decision. I just didn't think it was the role of the U.S. ambassador to tell the people of Botswana use condoms. I just thought that that was not something I should be doing. It's the president of Botswana could tell his people very bluntly what they needed to be doing, but it wasn't my role to say that. So instead I would talk about don't take risks and things like that. So our approach to prevention, which was just pervasive, we had billboards, we had radio programs that the Batusa Project was funding, a radio series, soap opera kind of a thing that involved HIV/AIDS. All of these efforts that we were doing with students, the media, the public, were geared to prevention, but not you really using the ABC construct.
You served as ambassador to Botswana during 2 presidential administrations. So started during the Clinton administration, concluded your time during the Bush administration. Did you see or experience any major differences across these 2 administrations?
Well, in December of the year December 2000, 1 month before she left office, Secretary of State Albright came to Botswana on a trip to several African countries. And she made HIV/AIDS one of the issues that she talked about, including in her meeting with President Moai and her meeting with Foreign Minister Marafi. She went to an old Naledi, it was called, a borough in Gaborone, and met with a woman there who had denounced herself as being HIV positive. And Secretary Albright hugged her, as did Joy Pumapi, the Minister of Health. That made front page headlines, hugging someone who was HIV positive. So you had support from the Clinton administration, and there was this LIFE initiative, they called it, Leadership and Investment in Fighting an Epidemic. And that gave more money to us, to the Batusa Project. We had, I think it was $4 million, and it went up to $8 million in 2001 when it was renamed to the Global AIDS Program. But we were getting money in, and I don't know what the totals were each year, but on average, we were getting about $12 million a year for the Batusa Project. But that was not up to the task. By then, the problem had gotten so bad, and it wasn't really solving the problem because it wasn't providing a substantial money toward antiretroviral therapy, which PEPFAR eventually did. Instead, it was focusing on prevention activities. And I must say, despite making this my signature issue and using my soapbox to talk about HIV prevention, and I mentioned HIV/AIDS in every speech I gave, even if the subject was U.S.-Botswana trade and economic issues or military-to-military cooperation or whatever. I always mentioned HIV/AIDS. You had the strong efforts on the part of the Batusa Project. All of this, I'm not sure that we really ended up doing much to prevent the spread of HIV. And let me just tell you one anecdote in that regard. I once spoke to the commander of the Botswana military over lunch at my house. And we had small lunch, and I did, as I always did, raise the issue of HIV/AIDS in the military and concerns about that. And he looks at me and he says, "Your Excellency, if I leave here and don't get tested for AIDS or HIV today, I'm going to have a good night's sleep. If I leave here, I go get tested and I find out that I'm HIV positive, I'll never have a good night's sleep for the rest of my life. Why should I get tested?" And that was really shocking to me in a way, but it really helped put place in my mind the difficulties of overcoming that stigma. And it was really hard to get people to be convinced to be taking an HIV test when the message was, then you'll be able to protect your loved. If it turns out you're HIV positive, you can protect your loved ones by taking precautions. You can make sure that you maintain good health and try to get good exercise and lead a healthy life as best you can. That wasn't a compelling argument for a lot of people, it turned out. So the stigma was just such a huge concern.
In 2000, President Clinton declared HIV/AIDS to be a security threat. Did that have meaning to you as a security issue during that period?
Well, I don't have an MD or a master's in public health. I'm a diplomat with a law degree. So I look on this in the broad context of U.S. national security, as diplomats do. And I thought that this was a real threat. One of the best quotations I've ever seen about the threat of HIV/AIDS in destabilizing countries was told by Kofi Annan, the Secretary General of the United Nations, at a special meeting of the UN Security Council in January of 2000. And that Security Council meeting was initiated by the U.S. Ambassador to the UN, Richard Holbrooke, and the lead U.S. speaker at the event was Vice President Al Gore. And it was really the first time the UN Security Council had dealt with a health issue as a matter of international peace and security, because it was just so scary as to what could happen in Southern Africa when you have the number of people who were dying, and including government leaders and others who were becoming infected. So there was a concern from my perspective from really the beginning of my tenure in Botswana in December '99 for HIV/AIDS as a national security issue. And that continued, of course, from the Clinton administration to the Bush administration.
Interesting. Can you tell us a little bit about the Global Fund, which was founded in 2001? Did that impact you at all on the ground in Botswana?
I'm sure if you look back on what the government was able to do with the Global Fund to get grants out of the Global Fund, there was probably something there but I really wasn't focused on it very much and didn't. I met with the head of the World Health Organization at various times, their WHO representative in Botswana, but the Global Fund wasn't really on my radar back then.
Okay. In early 2002, several African leaders met with President Bush in Washington, D.C. Could you tell us about this summit and about its significance?
Yeah, in February 2002, President George W. Bush wanted to meet with three African leaders, President Moai of Botswana, Chissano of Mozambique, and Dos Santos of Angola, and to do it in a way that didn't require him traveling all the way to Africa, which in the months after 9/11 he was not in a position to be able to do. So this was a meeting that took place at the White House. The three leaders met with the president in the Oval Office for a short period, and then they came into the cabinet room of the White House, and there was the U.S. Vice President, the National Security Advisor, Secretary of State, and other secretaries, and the three U.S. ambassadors to those countries, including myself sitting in the back row. And we were there to hear the discussion, which included issues such as regional stability and security issues in Southern Africa, and including the situation in Angola, which was unsettled at that time, some economic issues, etc., and HIV/AIDS. And clearly the three presidents had orchestrated their speeches in advance, so that the obvious person to talk about HIV/AIDS was President Festus Moai of Botswana, and he spoke eloquently about that.
It turned out that Botswana played a fairly important role in the Bush administration's support for what ultimately became PEPFAR, and partially because of President Mohai, but also because of a trip in April 2002 that Secretary of Health and Human Services Tommy Thompson took. This was supposed to be a fact-finding mission to determine whether a program in Southern Africa and other places was feasible. What were the key questions that Secretary Thompson was trying to answer, and how did you respond to them?
The basic thrust of that visit was to see if African countries were interested in and capable of developing much more robust programs against HIV/AIDS, so that it was kind of testing if the U.S. government were to increase its efforts, would they be ready for it? And they visited 4 countries. I think it was Mozambique, and then they went to South Africa, then Botswana, then Cote d'Ivoire. And it was just shocking to me when they arrived how dispirited they were after being in South Africa. To my knowledge, they weren't able to meet with President Mbeki. They did meet with the Minister of Health, Shabalala Msimang, known as Manto, and she, and I met her a couple of times. She promoted beetroot as a possible cure for AIDS. She didn't. She questioned whether antiretroviral therapy was poisonous. I mean, she was just a real disaster as a health minister. And so they were, they had learned a lot, and I think they went to the Ford Motor Company there, which had a very advanced program on HIV/AIDS for its employees. And they looked at various things, but it was really civil society in South Africa that was focused on the HIV/AIDS problem there, whereas the government, led by Thabo Mbeki as president, was very negative. And Mbeki, because of something he read on the internet, didn't believe that HIV caused AIDS. They get to Botswana and they're welcomed with open arms. And they arrived in the morning, if I recall correctly, and we had a big luncheon with emphasizing public-private partnerships. Joy Pumapi spoke, the Minister of Health, and welcomed them. They ended up going around at the various sites. They visited a hospital wing with HIV/AIDS patients in it. They ended up they were able to attend the grand opening of our voluntary counseling and testing center in Gaborone. I think it was the groundbreaking ceremony was what it was, because I recall Tommy Thompson with a shovel up there for the groundbreaking. And to emphasize the importance of voluntary counseling and testing. They really learned a lot from what they were seeing. And then it really was most important to have the meeting with President Mohai. And the whole delegation, this was like 50 people in this delegation in a U.S. military plane, including Dr. Tony Fauci and various other HIV/AIDS experts from the United States. The whole delegation couldn't attend this meeting in the president's office, but I was there, of course, sitting next to Tommy Thompson, and then we had about 8 or 10 others, maybe even more, in the room to talk to President Mohai, with a particular emphasis on nevirapine and trying to prevent mother-to-child transmission. And Mohai was very receptive, and he was questioning, and he wanted to know specifics and things like that. But on the whole, it was a very, very positive meeting.
What was your, your relationship like with Secretary Thompson and with Dr. Fauci?
Well, Secretary Thompson and I have actually seen him at various times over the years since then. He was a graduate of the University of Wisconsin Law School, as was I, and he later became Wisconsin governor. So we had a bit of a rapport, and in fact, one of the things that we did was when I was in Washington for that meeting at the White House that President Mohai had with President Bush and the other African presidents, I also met separately with Secretary Thompson in his office and arranged, got his approval to have a Wisconsin reunion in Gaborone at the same time as the reception I was hosting for all of the people who were actively engaged in HIV/AIDS programs in Botswana. Half a dozen cabinet ministers from the Botswana government came to it, including the Minister of Health, Kumapi, and the Minister of Foreign Affairs and others. And so we had this big gathering, not only of the Botswana people working on HIV/AIDS, but University of Wisconsin alumni because of that. So I worked very well with Secretary Thompson and have great respect for him.
Do you recall where the delegation went within Botswana specifically?
I don't have, and I looked through my documents at one point recently. I don't have their exact schedule. And like I said, it was the groundbreaking ceremony for the Voluntary Counseling and Testing Center and the hospital visit. Princess Marina Hospital was often one which we would people would visit, and see President Mohai in his office. But I can't remember the other elements of their schedule.
A number of individuals who were on that mission and other missions like it recall the powerful role that engaging children and mothers played in creating support for U.S. action against the pandemic. Were you able to witness that firsthand?
Yes, we arranged for those kinds of interactions during their visit, and in so many other ways. Just as an aside, I still remember going to a meeting in Francistown in Botswana, toward the north of Botswana, and going to a facility that cared for AIDS orphans and other children. And AIDS orphans meaning those who had lost one or both parents to AIDS. And they sang a song to me with the refrain, "My mother died before I met her." And it's that kind of thing that really tugs at your heartstrings. When I arrived in Botswana, you asked me earlier about what was the situation upon arrival. You had the estimate was there was one baby born every hour who was HIV positive. And the idea of having babies born HIV positive was just such a tragedy. And it was really the kind of thing that motivated people in the United States who visited, including Secretary Thompson and his delegation, to try to help Botswana, as well as other countries who were HIV affected in the same way, to prevent that mother-to-child transmission.
It's really difficult to imagine being surrounded by that much pain. The delegation was also putting out feelers, you mentioned this, for the president's new initiative on mother-to-child transmission. Did it take much convincing for Botswana to sign on to this program?
No, I mean, they weren't pushovers. They would think things through thoroughly, and including practicalities of using nevirapine or other medications or whatever policies. But they were so supportive, and they had a national AIDS coordinating agency, NACA, that was trying to coordinate among different government entities to move things forward. The government on the whole was just very, very positive and supportive.
And around the same time, there was a clinical trial supported by Merck and the Gates Foundation, which was a very large trial aimed at investigating ARV therapy in adults. Early on in the trial, the numbers were not very large. Did you have any sense of this clinical trial during that period?
Maybe Dr. Kenyon did, but I wasn't really following it closely.
Fantastic. So you do your tour in Botswana, and then you head back to the United States. Could you tell us a little bit about what you were up to in the United States after that?
Yeah, I was asked to run what was called the Senior Seminar. It was the highest level U.S. government military and civilian training program. It was a 10-month program to train the next generals and the next ambassadors, shall we say, people at very high levels, but to train them for that next level. And it was a wonderful program. The State Department, for various reasons, hasn't been able to continue it. But It was a really good program where we met with all kinds of leaders in the United States, private sector, public sector, non-governmental sector, etc. And I was supposed to do that for 2 years. And after the first year, we then had our summer break, and I was waiting for the next class of military and civilian officials to come in August. And then it turned out that on July 2nd of the year 2003, the president announced that the head of PEPFAR would, as it was eventually called, to be the U.S. Global AIDS Coordinator. And I was then in the State Department, and we can talk about the earlier origins of the creation of PEPFAR if you'd like, but the State Department was really out of the loop when PEPFAR was developed, and it was first announced by the President George W. Bush in his State of the Union address in January of 2003, passed by the Congress in May. The State Department was really not directly involved in much of the discussions of this. Secretary Colin Powell had so many other things to worry about at that time in the War of Terror. So July 2nd, the president announces his nominee, that he will be nominating Randall Tobias as the U.S. Global AIDS Coordinator. The State Department was not really prepared, so they ended up calling me on the Monday. 5 days later, I got a call from the Undersecretary for Management's office asking me if I could come in the next day to set up the office, because Randy Tobias was showing up at the State Department on Wednesday. And this is the kind of thing where they chose me because I had had that experience on HIV/AIDS. Secretary Powell had written a column in the State Department Monthly Magazine about that commended my work and leadership on HIV/AIDS in Botswana, as well as other people he talked about in his column. I really had a reputation of working on HIV/AIDS, so I was, in many respects, the logical choice for this. And it also turned out that because we were at this hiatus in the senior seminar, I was available. So I got a call in the middle of the day on Monday and came into the office on Tuesday to set things up for Randy Tobias's arrival on Wednesday. Now you could say, well, how do you just set up an office so quickly? But the State Department is very accustomed to that, because you have so many people who are nominees who have not yet been confirmed by the U.S. Senate, who need a place to sit and to use as a temporary office as they prepare for their confirmation hearing and things like that. So there was a office suite that we were given, and I was provided with a secretary to help us set it up, and we got the computers set up, and we were ready when Randy Tobias came to the State Department the next morning. So that Wednesday morning, after a quick 24 hours, where I met twice with the Deputy Secretary of State and the Undersecretary of State for Management to talk about how we were ready and how important this was. And that was the Tuesday. On that Wednesday morning, at the C Street entrance to the State Department, I went there at something like 7:45 or 8 in the morning and met Ambassador-designate Tobias, and we went up to meet with the Deputy Secretary of State.
Talk about a whirlwind experience.
Yes.
So I'm fascinated to hear more about this. Were you surprised when PEPFAR was announced?
Yeah, that was in the State of the Union address, and I was, at that point, as I said, running the senior seminar, so I was no longer involved in public health issues. And I ended up just watching from home on the television, the State of the Union address. And I think it was only about 6 paragraphs of his address, where as much of it, of course, was on the war on terror that we were concerned about following 9/11. But it was just astounding to me. And if I recall correctly, my wife was elsewhere at the time, I applauded at home with nobody around, just because it was such a huge amount. And I have felt since then, because there's a debate that we can talk about the vertical health systems versus horizontal health systems, and do you try to build up a health system throughout with a particular focus on primary health care, or do you try to deal with disease specifically, like the polio program to eradicate polio, or PEPFAR for HIV/AIDS, TB, and malaria? And if President Bush had announced that he was developing a program to spend $15 billion over 5 years to develop health systems in developing countries, he may have not gotten any of the money. Instead, it was a specific program with specific goals. And the bottom line, of course, was to save lives. And that was able to get congressional support, and it was a delight that to me when it was announced and then eventually approved.
So you meet Randy Tobias maybe at 7:45 a.m. Can you walk me through setting up that office and actually making it functional, and then preparing him, excuse me, to go through the confirmation process? What was that like?
It was hectic at all times. I remember when I first got at I changed my email address within the State Department to be in the office of the Global AIDS Coordinator. At that point, it was still called, I think, a task force before it became official. And I just was inundated with emails, just people from some people want to work there, some from within the State Department, et cetera. Everybody, this was the big new thing, and with money attached. And we got a lot of support from the Secretary of State's office, called the Secretariat, but it never was enough, because it was just it's very hard in the State Department for a Foreign Service officer to suddenly leave a job and move on to another one for a 1 or 2 year tour. And so we had some people come in temporarily, but then they left, and others came in on what they call short tours. There were people in the civil service who could come over on detail for a short while. We were able to bring in people from other departments, and some of the other deputy global AIDS coordinator besides myself, once we got established, was Dr. Joe O'Neill, who had come from HHS and then the White House Office of National AIDS Policy, and his a co-worker, or the person reporting to him, was Dr. Mark Dybel, who of course became U.S. Global AIDS Coordinator later. They knew a lot of people from HHS who could come over. There were people we brought in from USAID. It was always trying to get the place staffed. But in my view, when I was in the office for 1 year, an exhausting year, we were always understaffed. I don't think there was a single time when we were fully staffed for what the task was at hand. And part of that, I feel frustrated that I wasn't able to do the staff things up faster, but there are so many U.S. government restrictions on this kind of thing as to how you can bring in people, and especially in the State Department, which has all these classified computer systems, so they had to have a certain minimum level of security clearance, even if they didn't require a top secret clearance, just to be able to get in the door. And it was just such a difficult time. We couldn't stay in this temporary office space provided by the State Department forever. We had to find another location for that, and to move to offices which were in a state annex away from the main State Department building. There were just so many administrative issues that we had to cope with. And at the same time, I was not only given charge of dealing with the administrative and management issues, but also the global health diplomacy side of things, which is what I had been focused on when I was the U.S. ambassador in Botswana, what I call global health diplomacy. And that took a lot of my time also.
Could you tell us a little bit about Dr. O'Neill, what your relationship was like with him, and the extent to which you worked together during this initial phase?
It wasn't always an easy relationship because he had worked on this and really developed it from his position in the Office of National AIDS Policy. Dr. Fauci, Dr. Dybel, and others had been part of this in HHS, but it was really a small group working with the leadership in the White House who came up with PEPFAR, and they had their own visions for it. And that was different from a State Department environment. Now you can ask, why was PEPFAR put in the State Department? Well, I wasn't part of these discussions at all. I felt I had some input on it from Tommy Thompson's visit as Secretary of Health and Human Services to Botswana in April of 2002, but I really wasn't part of the discussions at the White House in Washington on how to establish this new program that became called PEPFAR. But I was told that they didn't want to put it in USAID because that would get the people in HHS and CDC upset, and they didn't want to put it in CDC or HHS because that would get the people from USAID upset. So State Department was this kind of neutral site where they could put it. And that, I think, worked and still works. I think that's the best place for it because it really shows what was clearly intended from the very beginning, to have the U.S. Global AIDS Coordinator coordinate and direct all U.S. government resources to focus on HIV/AIDS.
I'm wondering how challenging it was to try to coordinate people from State Department, HHS, and from USAID. I imagine everyone had different ideas about what things should look like, and you're in this role trying to bring everyone together.
Here's where I give Ambassador Tobias great credit. He had been a CEO at Eli Lilly. He was clearly a top-notch executive in the private sector. And he had his marching orders from the President of the United States when he was announced on July 2nd of 2003 as the person the President would nominate to be Global AIDS Coordinator. It was very clear he had support from the President. And the long-term plan, once the budgets got straightened out, was to have PEPFAR being in control of U.S. government resources. Well, even when the money in that first year especially had been appropriated to USAID or to CDC, he insisted that PEPFAR had control of this. I think, established that program to be exactly the way the President wanted it, which was rising above all of the interagency rivalries to have a coherent, coordinated program. Well, when we were there, when we started in those temporary offices in the State Department in July of 2003, one of the things that happened very early was Secretary Thompson invited Ambassador Tobias and me and Dr. O'Neill, who was already, I believe, on board by then, to the Secretary's Operations Center and Suite in the HHS building in Washington over lunch. And we had a very nice gathering there to talk about the role of HHS, including CDC, in PEPFAR. I think I was the one who then alerted the administrator of USAID, Andrew Natsios, that this had happened in case he wanted to do the same thing at USAID. Because I was very attuned to the need to keep everybody coordinated. And Natsios then invited us over to USAID for a similar briefing. And it was very much the kind of thing where everybody was jockeying for positions. And Natsios, I had heard him give a speech before PEPFAR was finally approved by Congress. I heard him give a speech in which he was saying it should be located in USAID. There was no secret that there were these bureaucratic tensions, but the thing that they all knew was that It was the U.S. Global AIDS Coordinator, Ambassador Tobias, who had control of the money, and that's what they needed to be effective. So they had to cooperate with us.
So ultimately, these agencies, the knowledge, they knew that this was coming from the president through Tobias, and so they were, there wasn't strife between them.
No, there was strife, but it was, but it wasn't debilitating, and I guess, because there was a decisive end. Decisions were made because Tobias was in a position to make those decisions. It's like I've been in a lot of bureaucratic battles during my 28 years in the Foreign Service, and sometimes they're just unresolved, or sometimes they take forever to resolve. Because you have one agency versus another, whether it's state versus the Department of Defense or who knows what, and there isn't a decisive conclusion for way too long, and sometimes never. That was not the situation, I would argue, in my year in PEPFAR, because Tobias, whenever those kinds of things came along, would be decisive and move things forward. So yes, you had strife, but it was still the kind of thing where things moved forward.
That's very interesting. Could you tell us a little bit about the process of initializing PEPFAR on the ground in the host countries? How did you get buy-in from these different nations following sort of a surprise announcement?
Yeah, there were complaints that countries made because they hadn't been advised, except maybe on the day of the State of the Union address, but they really hadn't been advised and consulted in advance. And in fact, the South African health minister, when Ambassador Tobias and I met with her, would complain that that some countries hadn't been consulted in advance, including South Africa. And even President Mohai at one point said, nobody asked us to be a PEPFAR country. It was like a fait accompli, you're a PEPFAR focused country. And that's not really the way that you normally deal with the bilateral relations with a friendly government. So it was because of the need to keep things close hold, there really had not been sufficient consultation, in my view, with governments in advance. But once it got going, the governments knew that this was just a huge amount of money that was going to be coming into their country to protect their people, and they quickly came on board. One of the things that Ambassador Tobias and I did was to fly to Africa shortly after his swearing in, and it was even used as a reason to expedite his swearing in, because he was, and to expedite his confirmation by the U.S. Senate, because there was a real sense that this was an emergency, and there was a meeting of all U.S. ambassadors to Africa, to sub-Saharan Africa, the Africa Chiefs of Mission meeting that was taking place in my old stomping ground, Gaborone, Botswana, in early October of 2003. So what we were able to do was to get Ambassador Tobias quickly through the confirmation hearing. We had prepared him for that. He had this hearing that went well. We had something like 37 questions that were submitted for the record, and we had parceled those out so that they could be responded to within 24 hours in terms of U.S. senators who had additional questions to ask. He was then confirmed and sworn in the State Department in a small ceremony, because we didn't have time for the big fancy ceremony that could come later. And then he and I flew to Gaborone, and I think it was 4 days after he was sworn in, he and I were meeting with President Mohai and the then U.S. Ambassador to Botswana in Mohai's office. And the reason to do that, to have him be at this African Chiefs of Mission meeting, was to emphasize what this new program was to all of the U.S. ambassadors to sub-Saharan Africa. And then the next day, the last day after some of those ambassadors left, the ones from the focus countries were present, and then we went through more specifics. And the goal of that then was to get the ambassadors on top of this, because I think one of the key things, and I'll take some credit for this, was to have the ambassadors as the focal point, because when I first got there, Ambassador Tobias, who was new to the U.S. government, had the thoughts of having his own person in each embassy who reported directly to him. And I emphasized the role of the ambassador, who was in charge of the direction, coordination, and supervision of all civilians at post, as well as military who aren't under a central military commander. So you had this role of the ambassadors, and based on my pushing and others, it was decided the ambassadors would be the focal point and put the onus on them. Now, I told you how when I was in Tanzania earlier, or in Togo years earlier, health, I looked on it as a USAID development issue, not as something that came to the fore for an ambassador or a deputy chief of mission. Well, that was kind of the revolutionary aspect of PEPFAR in terms of how U.S. embassies were structured, to put the burden on the ambassador to ensure that there was full coordination within embassies. And the ambassador then had to butt heads between USAID and CDC if there was the strife that you mentioned. And in some cases, we were able to provide PEPFAR coordinators, a staff person who would help out the ambassador on this. But the idea was to put the onus on the ambassadors and have them then sell this program to the host governments.
So it sounds like you had a fairly clear vision of what implementation should look like on the ground, and that was informed by your own experience as an ambassador?
Yeah, certainly had views. And in fact, within a month or two after I got there, I remember sending a message to a memorandum to Randy Tobias and Joe O'Neill about what I thought was needed to succeed in Africa. One of my emphases, for example, was how every country is different and every culture is different. And you have sub-regions. You have West Africa, Central Africa, East Africa, Southern Africa. You've got the countries that have divisions within them. Sometimes it's based on tribal or ethnic lines. Sometimes it's religious, the cultural differences, etc. And you just have to take those things into account. It's not like, and I think this is just a common amongst way too many Americans who've never been to the continent. It's not like, well, they're all Africans, they're all the same. I really thought it was important to make those differentiations, to focus country by country, therefore, not to try to have some blanket policies and procedures that didn't apply in certain countries, and to do this in a way that focused on the host country and host country partners, to do it that really wasn't just somebody flying in to implement programs, but you really worked with the partners at the host country level.
So how did you start spending funds, actual money, maybe around $2.1 billion during that first year of PEPFAR? What was your approach, and who were your partners on the ground?
Yeah, I'm not the best person for that because, as I said, what my work was, it was on the management and administrative side, media, and the diplomacy side. Joe O'Neill was really the program for the focus countries. And so he and Mark Dybel would have a better sense of that. But that first year, as I mentioned, budgets still hadn't been reconfigured. So the money had already been appropriated to USAID and to CDC. So they had the money. But it was part of the overall authorization for PEPFAR, but the appropriations had already been there. And so the money still had ways to get out, to be distributed, but it was in a way that was not, that had to be consistent with what PEPFAR was all about. And that took some effort because there were things that some money had been spent on that weren't really PEPFAR priorities, and it really had to be focused on what PEPFAR was doing. And the PEPFAR, the specific goals over the five-year authorization were 2 million lives saved through treatment, and 7 million infections prevented through prevention programs, and 10 million people affected by AIDS or with AIDS cared for. So it was the 2-7-10, and we would repeat that frequently in speech after speech.
And I believe that you and Randy Tobias, Ambassador Tobias, developed a 5-year plan for PEPFAR at the very onset. Do you recall that?
Well, certainly we had a 5-year strategy. I think it was released in February of 2004. That was required by the act of Congress that created PEPFAR. And the strategy was really comprehensive. If you look at it even now, it's a very impressive document, given the time frame when it was first produced. It talked about those goals that I just mentioned. And if you look at it, the very first goal was to talk about engendering bold leadership and pushing for bold leadership. And that's what I thought was my biggest contribution in terms of that strategy, because I wasn't the program expert. That really had to be the people who were the development assistance experts, the medical experts, the health experts with their PhDs. For me, as an ambassador, it was that the leadership side of things. And to give you the prime example, and this is, I found this when I was in Botswana as the ambassador there, was the difference between Thabo Mbeki and Festus Mogae. And you could just see how important leadership was. There's an estimate, I think the number that Harvard came up with was they estimated that 365,000 people lost their lives in South Africa because of the South African government's intransigence during when HIV was spreading so much, and the Mbeki policies, and you just had so many lives lost as a result of that kind of ignorance. That view that HIV didn't cause AIDS and all these other concerns from South Africa didn't cross the border into Botswana. As I was saying, you had this very strong support on the part of President Festus Mogae. And that's, to me, that was the fundamental lesson I learned from that experience in Botswana and observing South Africa at the time and focusing on HIV/AIDS was the importance of leadership. And you can look at it in terms of leadership during COVID as a pandemic in the same way, the importance of leadership. And that was the main focus of what I was expected to do, and that what the small team that I developed were focusing on through the ambassadors and others to try to push for that leadership. Not that it's sufficient. You can have a strong leader and a weak program that will not accomplish your goals, but it's a necessary element. Without that leadership, programs are underfunded. You can't attract the best people because the president and prime minister don't care about it. Without the leadership that is so important, you end up weakening the entire program.
Accountability was a key aspect of PEPFAR's design. Can you tell us a little bit about setting up the accountability structures for the program?
Well, the one that I was involved in was called the 3 1s. It was something that was pushed by UNAIDS, but we very much cooperated with them. And the idea was to have one broad coordinated policy for each country, one national coordinating agency for each country within the government, and one monitoring and evaluation system. And the reason that UNAIDS was pushing this, I believe, was because you had the Global Fund to fight AIDS, tuberculosis, and malaria doing their thing. And then you had the PEPFAR program doing its thing. And it was clear we needed to we couldn't just be placing duplicate demands on the recipients, where you have one poor person sitting in a health ministry who's got to answer this and answer that and all these things in different formats and structures. You needed to have a coherent approach. What we in the US government did not want was an insistence through these 3-1s to have one funding mechanism, that everybody gives money to one big fund and then it trickles down. That was something that we weren't going to accept, because we thought that we had more flexibility and credit to the United States for a bilateral program. But that was then complemented by the other programs and collaborating with the Global Fund and their efforts. And that was a major mechanism, and I was a lead negotiator for that when it was finally approved.
Overall, your relationship with the Global Fund during this period, was that difficult? What did it look like?
I was not the U.S. representative to the Global Fund Board, so I didn't have the lead on that. But there was a fair amount of unhappiness at one point, because there were some criticisms of PEPFAR that were coming out of Global Fund sources. So one of the things I did at times in my role on global health diplomacy was to fly to different parts of the world for HIV/AIDS conferences, etc. Randy Tobias often felt that he couldn't spare the time to do that. He wanted to stay in Washington and work on the program, although he did go to some of those conferences. But I was the U.S. representative in various situations, including a big conference in Europe at one point that took place in Dublin. And in June of 2004, I went to Europe for meetings and met with the executive director of the Global Fund, Richard Feacham, to talk about the programs that we were doing. But I, under instructions, was given a letter to hand to him. And that letter was very much telling him that we were going to go public if I recall correctly, we were going to go public if this criticism from Global Fund sources continued on the PEPFAR program. And the letter, at the time that I was meeting with him, was transmitted electronically to the board of the Global Fund. So we had this nice conversation, and then at the end I handed him the letter, and he clearly was very unhappy with the letter, and if I've got my facts right, within hours responded to it that evening, writing up his response. So we had some differences at times with the Global Fund, but at the same time, you had Secretary Tommy Thompson and others who were very active in the Global Fund to help shape it. And I think you can look today and find two strong programs on HIV/AIDS, and you've got the Global Fund and you've got PEPFAR, and they're both going along today.
Yeah. That's interesting how many different people were involved. Did you witness any, we mentioned sort of the strife, do you recall any specific tiffs between USAID and CDC or HHS?
Well, I don't think I have some specific ones, but one of my roles in this office, and it was kind of an unofficial role, was to be a sounding board for the embassies. I was the one who had experience at a U.S. embassy. Dr. O'Neill had not been stationed abroad. And everybody knew that I had worked on HIV/AIDS in Botswana, so I had a reputation being an activist in this regard. And I get a lot of feedback from the embassies, particularly the State Department people, but others, and ambassadors about concerns and things that were going on. And clearly one of the big complaints from the very beginning was the country operating plans, because we in PEPFAR had this great idea to have a country operating plan with specific formats, and PEPFAR, since its inception, has been very good at monitoring and evaluation and to ensure accountability. But these were people who were working for USAID and working for CDC and maybe other agencies to some extent, Peace Corps and Department of Defense and others. And they already had their requirements from their home office and their home agencies. So you were in a situation where they were given double duty and didn't have double the staff to do double duty. It was just such a burden on them, and that was part of the problem. And it was almost it wasn't so much strife between USAID and CDC as much as strife between those agencies at Post and PEPFAR office, because of these demands for these country operating plans. Now, we were saying, well, USAID shouldn't have to insist on the same plans that it used to, because we have there's a new sheriff in town, shall we say. It's the U.S. Global AIDS Coordinator. But that's very hard to accomplish quickly in a U.S. government setting when the appropriation's already there and it goes through USAID's normal mechanisms. So there was a lot of unhappiness about that workload, clearly.
It seems like the COPs were not a particularly well-received aspect of PEPFAR.
No.
So I didn't ask you, could you maybe, if possible, tell us a little bit about your day-to-day work during this period?
Like I said, I made a fair number of trips to promote this effort. In fact, a trip to the conference in Dublin on HIV/AIDS in Europe. I remember afterward talking to the French ambassador for HIV/AIDS, who said that my presentation and others at that conference turned around French policy toward dealing with HIV/AIDS internationally. We were trying to have an impact through that way by having a strong presence and to really emphasize how important PEPFAR was as this game changer, and as part of that, to urge other governments to contribute their own funds, either bilaterally or to the Global Fund, for HIV/AIDS. That we didn't want to be the only ones. We had 15 focused countries, and we were still operating in over 100 other countries in smaller levels. But there was so much to be done, and other countries, other donor governments could and should be participating. So that was part of my role, and that includes some traveling. When I was in Washington, there was a daily staff meeting that Secretary of State Colin Powell had at 8:30 a.m. That lasted 25 minutes or so with his assistant secretaries. And Randy Tobias was expected to go to that because he reported directly to the Secretary of State. And this was a meeting for all assistant secretaries and above at the State Department. But he often didn't have time or was out of town and couldn't attend. And Dr. O'Neill wasn't all that interested in going to them, so I often went to those. So my day would start out, maybe half the time, going to Secretary Powell's 8:30 a.m. staff meeting, which I have to say was very interesting. He was quite a leader, and you'd hear him, and he would go around the room and ask everybody at the table if they had something to say. And if you didn't have something to say, you had to actually say that, nothing to report, because he really wanted to hear from everyone, and yet it was a very compact, in terms of time, meeting. Coming back to the office, as I said, we were inundated with emails. The staffing issues were a major concern, and budgeting issues for the office itself, separate from the program assistance that we were providing. There were all kinds of visitors we would have. In my office at one point, because Randy was unavailable, I met with President Moi, who at that time was former president of Kenya, who was trying to get money from us, as so many people were. And he had a foundation in Kenya that really didn't seem to be doing much on health, but he was hoping to get our money. We didn't get our money. I once had a congressman call on me in Washington. Now, when you're abroad at a U.S. embassy, congressmen and women will come to visit. But in Washington, you go to them; they don't come to you. Here was a member of Congress who came to call on me with his constituent to try to get money from our program. There is no typical day, I would say, in terms of what it was like coming to work, because there's just so many things that were going on. And as I said, we were at every moment of my year in the PEPFAR office, I think we were understaffed.
And I think I read that the congressman who visited you was the famous Duke Cunningham from California. So obviously that's perhaps an example of domestic corruption. Did you encounter other sort of things along those lines during this period?
There was no detection of corruption with his relations with PEPFAR. There was nothing to indicate there was corruption involved in his visit with me, and I don't believe that we gave his constituent money. Representative Duke Cunningham was found guilty of other things that were, I think, is more Department of Defense contracts. I didn't encounter, or don't recall encountering corruption within the PEPFAR program. Now, it's something that one always has to be concerned about, and the farther you are from your implementing partners, if you're trying to spend money from Washington, and it's often thousands of miles away is where it's being spent, the opportunities arise. But I had encountered in other stages of my career some corruption that seemed to come up, but not in terms of my time in PEPFAR.
Sometimes critics of PEPFAR have mentioned, the program's impact on the autonomy of nation states. Did you have any perspective on that during that time, or how did you think about those types of questions?
There were so many ways in which you can say, well, this should really be done at the local level and support the government. And that sounds fine in theory, but when you're trying to quickly ramp up a program like this, and you're trying to save 2 million lives over 5 years, you can't just go through the budgeting process for the government of Swaziland or the government of Botswana or whatever. You need to act quickly, using local partners to the maximum extent. But it's a fine line to draw, and it also gets back to the discussion of having a horizontal program to build health systems versus a vertical program that's disease specific that I mentioned earlier. I've come to the conclusion that what you need is the diagonal, that you need to be able to attract funding from parliaments and congresses for a program that will have specific goals, and in this case, trying to save lives, prevent HIV infection, care for those affected, that will have specific goals, while you build up the health system through the government, Ministry of Health, and local partners. And that's very tricky to do, but I think it has to be the approach. Doing it just in a vertical sense doesn't work. There seemed to be a time in the early stages of PEPFAR where the attitude in the part of some of the people implementing the program was they didn't care if they stole the last nurse in town to work for the PEPFAR office and the PEPFAR clinic, even if that meant that the citizenry would then be bereft of the normal health clinic. I was opposed to that kind of thing. I thought you had to be able to cooperate, and you couldn't just think, well, I have these goals. The president says these are the goals, therefore we're going to meet them come hell or high water. You had to do it in the context of the government, and I tried to get that across in my the memorandum I sent to Ambassador Tobias and Dr. O'Neill early in my tenure there, and in subsequent discussions.
After you left SGAC, the PEPFAR program, you continued to work on global health issues in a number of different venues. I'm wondering if you can tell us a little bit about how PEPFAR, you mentioned leadership a few times, how PEPFAR influenced your thinking about public health or global development in general.
Well, after the PEPFAR my time in PEPFAR, I was asked to be the Deputy Inspector General at the State Department, so I did that for a couple of years. And then, at short notice again, got asked to become the Special Representative on avian and pandemic influenza, when that was a top priority of President Bush in terms of pandemic preparedness due to the concerns for H5N1 bird flu. And in that role, when I came to that role, and I really got that role because of my work in PEPFAR and in Botswana on HIV/AIDS, and I knew all the players in HHS who were important for this. When I came to that role in 2006 as the Special Representative on Pandemics, I knew the importance of leadership. I knew it from my time in Botswana and the President Festus Mohai's leadership. I knew it from my time in PEPFAR and how we could work more easily in countries where the top leaders were supportive. And so that was one of the things that I made it an emphasis of when I was heading this office. It was really like a task force in the State Department, where our role was to coordinate U.S. international engagement on pandemic preparedness. Again, it was the role of the State Department because we had all these embassies and we were in the position to deal with this. And as we saw from COVID, pandemics involve all sectors of society. It's not just a health issue. So that approach that I had learned from PEPFAR was the kind of approach I took through my work in pandemic preparedness and response at the State Department. That was my last tour in the Foreign Service.
So you were involved at the ground level in a program that has had a monumental impact on global health, has saved the lives of 50 million people. Reflecting on that more than 20 years later, how do you feel about this experience?
Two answers. One is, one of the most difficult years I had in my Foreign Service career was that year in PEPFAR. It was just so difficult trying to create a new office in the State Department, working with USAID, HHS, the White House, embassies around the world in a way that for those who came later after that first difficult year, it was much easier because by then systems were in place, appropriations and budgets had been reconfigured, et cetera. But that first year was extremely difficult. And the staffing it up, all those issues that I've talked about. So it was a very difficult year and very time consuming. And in other respects, it's the most gratifying year that one could possibly have in one's career to launch a program that has saved millions and millions of lives. And it was something I cared so deeply about, as I showed in my time in Botswana, that I really cared about it. To me, to have PEPFAR become such a success, that it did succeed. And in those first 5 years, we were supposed to have an appropriation of $15 billion, and Congress upped it to $18 billion because it was so successful. Now, one of my frustrations in recent years, and this is before the changes in PEPFAR that took place in 2025, has been to go to the World Health Assembly, because I've attended almost all the World Health Assemblies since 2007, either as a US government delegate or a representative of the Gates Foundation or representative of the UN Foundation, where I am now. And at those World Health Assemblies, listening to the speech given by the US Secretary of Health and Human Services, they always mentioned PEPFAR, and it was like a paragraph. And they would talk about this health issue and this health issue. Oh, and yeah, we're doing PEPFAR, we've got this, blah, blah, blah. And it's just kind of to me, the idea that the US taxpayer was contributing $6 billion a year, which is the amount that it was in recent years, to this program that is helping so many people to survive, deserves huge credit, and all these other programs that other governments are doing pale in comparison, and it should have been given greater emphasis. I think it's closer to the Marshall Plan, which was, of course, post-World War II and trying to build up Europe. I mean, the idea of how many, when you just think about the the millions of people who are alive today because of the U.S. government. And so it's something to be very proud of.
I've really enjoyed speaking with you today. Is there anything that I've missed during our conversation that we should be aware of?
I've emphasized it, and that is leadership. And I think, I really think it's important for the U.S. government now and in the future to show that leadership in global health. And we can't do it alone. The concern back in 1999 when I got to Botswana was not that, well, the people of Botswana will be maybe badly affected, but it doesn't affect us elsewhere. It affected the world. HIV/AIDS is a global disease. And in fact, that was one of the points I would make when I was giving speeches, that I wasn't trying to make the Africans feel bad because you got a problem. No, we have an HIV/AIDS problem in the United States also. And given international travel and everything, these issues spread. We saw that with COVID. It wasn't the kind of thing where you could just close the border and leave it and it'll stay in China. It spread globally. These things are global issues that require a global approach through bilateral programs and through multilateral programs, whether it's the World Health Organization, the Global Fund to Fight AIDS, TB, and Malaria, Gavi, the Vaccine Alliance, UNAIDS, UNICEF, etc. These are global institutions that work to improve health, and all of that affects us in terms of U.S. national security and global health security. And I hope we can be leaders now and in the future.
Wonderful. Thank you so much.
Thank you, Daniel.